Roanoke Chowan Community Health Center has a system in our electronic medical record, and when you walk into the room you see us working on it. And one of the key things of why we got this electronic medical record was because of the patient portal, or what we call MyChart. So you may have even heard that out in the community. So MyChart access, meaning that more access to your patient care system. So MyChart is just another way for us to connect, another way for you to connect to your provider and to your healthcare team. Now, if you don't use the internet, if you don't have an email address or use a smartphone, it might not be the best way, and you might need to use the phone. But if that's a part of what you usually communicate with, then that should be a way that we usually communicate with you as well too. So let me tell you about my mom. My mom uses MyChart, and her provider, her primary care provider, got her signed up early on. And my mother has a little bit of high blood pressure, and so her provider, who's a nurse practitioner, her name is Maggie, and Maggie said, listen, let me sign you up right here, and will you send me your blood pressure every Thursday after you take your blood pressure medicine, and we'll track it, and we can get some feedback on it and see how things are going. And if anything else comes up, just send me that. And it's not an emergency access, it's a routine access, and that way we can track what's going on with you. My mother's a quiet and private person, and about a year into using MyChart and her sending her blood pressure to Maggie once a week, she sent Maggie a message kind of after she sent her blood pressure. Oh, by the way, which is one of those things that usually you should pay attention to when a patient says, oh, by the way, I've been having a little bit of blood in my stool. Well, Maggie responds to the message the next day and says, well, tell me a little bit about that, Shirley. And my mother describes it. Maggie sends a message back, you know, let's come in. I've got an appointment next Tuesday in the morning, and just bring a little sample with you, and we can, you know, if you're not having anything else that's urgent, let's go ahead and catch up on this. I hadn't seen you in 6 months, and let's go ahead. So my mom did, and they started doing some testing and got her a colonoscopy, and my mother had rectal cancer. Now, I don't know how long my mother would have gone before she would have thought that this is worthy to go into the doctor's office. But because there was a relationship established through MyChart and a gentle communication that wasn't so intrusive, she was able to get access to her primary care provider and address her issues much sooner than she might have. And the good news in that story is my mother's doing very well and recovering well from that, and we expect a full recovery, but it was early identification. So that's another way to communicate. It's not an emergency way to communicate to your provider, but it's another way to us to stay connected to you, and you to stay connected to us. Sometimes it's hard to get us through the phone. We, at this site in Nahoski, we average between 17 and 19,000 phone calls a month. So that's a lot of phone calls in. When you can think about sending an email to your provider that is protected and private, because it's a part of our electronic medical record system. You can get your results from lab testing. You can get a request to refill your prescriptions. You can look at your own medication list and your own list of how we identify your diagnoses on there. You can get patient education information, so you can search and ask a question. And if you want to know a little bit more about hypertension, you just click on that and they'll give you a little more information on there. The MyChart icons are pretty easy and straightforward to look at, and you can actually look backwards as well too. So every time you come for a visit, we enter in your blood pressure and your weight and other key indicators, and it'll chart it right there for you. And you can see if you're on an upward trend or a downward trend. And the electronic medical record that we use is called Epic, and about 80% of the hospitals in North Carolina and in our service area in Southern Virginia use Epic, and they have a MyChart version as well too. And it's not for everybody, but it is one of the ways to connect, just like another way to have a relationship with our patient, and potentially life-saving.